Now when you think back on your 32 years of at CHA, what are some of the things that you are most proud of in terms of achievement as a board and an association and your role?
Well, every achievement we have was because of the team. And the board was not united in 1985. The membership was not united. And through the efforts of a lot of people, we were able to bring together all the constituent groups. We had to expand the board pretty significantly to make sure they were all there with a voice. And that led then up to a decade later to the reconfiguration of the relationship between CHA and the regional associations. And at that time, there was a complete restructuring, and we talk about aligning incentives today and making sure that all the parties have the same goals and that they are working together for mutual self-interest. We did that in 1994 and 95. And the three regional associations in CHA are truly aligned, single membership, single dues, consolidated, integrated, but separate budgets. And the staffs all work for one company, and the four CEOs are responsible for managing that enterprise from the staff level. So what we're asking hospitals to think about, we went through in the mid-90s. And it obviously depends on, first and foremost, trust within that enterprise. And I have been really fortunate to have worked with great individuals and down in San Diego Imperial counties, including the two that are present here today that were previous, and with Demetrius currently. We've had a trusting relationship. And the same thing's true with the other two regional associations. So we dealt with things as a team, and we were able, while each organization has to function and carry out its responsibilities, we were able to convert individual self-interest to mutual self-interest. And that's a challenge. And if you don't have people that are individuals of goodwill that are willing to step up and be that kind of a person in that group, then it falters. But I've been so fortunate that every one of the executives that I've worked with was a person of the highest integrity, goodwill, and the unit functions. We created CHI in 1986, and that insurance company still exists for professional liability and other products, and it had an impact on the entire industry. And then, we can't ignore the hospital fee. It has generated more than $18 billion for hospitals that hospitals would not have otherwise received. Does it have some flaws in it? Yes, it does. But has it been essential for the preservation of hospitals that have large Medicaid population? The answer is yes. It has been a lifesaver because the state didn't live up to its responsibilities from the general fund. Going forward, we are going to have new challenges, and it all depends on Congress continuing to allow provider fees to exist. And it doesn't have a rain cloud, but it has a cloud on the horizon relative to provider fees. But those were important. But as I look back, I think the biggest accomplishment was that hospitals collectively, through the regional associations and CHA, have dealt with tough policy issues, some of them divisive, and have always come to a consensus for the good of the entire public and the hospital community. And that really shows what I've said earlier. People of goodwill working together accomplish great things. And that's a tribute to everybody in this room and throughout the entire hospital community in the state.